You had it all along. It's right on the front of our website.
Okay. I need to go look at the website.
Oh, maybe.
You know, I bought a couple of computers. Your husband is interested in one of them. Okay. So the computers came yesterday without an operating system. Okay. So I get them out of the box, you know. I hook them up, no operating system. You know. So they're sending me 2 more computers. I have to send these back. So why don't you send me hard disks? Send me the operating system. Good morning.
That's the one I'm using, so it's lucky. Looks like we have to fix that clock up there. It's a little fast. Where's our buildings guy? Fix that clock. It's like 2 or 3 minutes fast. All right, the time being 9:01 a.m. on September 22nd, 2021. I'd like to call this meeting to order of the Kane County Public Health Committee. Committee Chair Jared Sanchez. Clerk, could you please call the roll?
Silva, Lewis,
Lewis, yes.
Shepro, Strathman,
Strathman here.
Tepe,
Tepe here.
Wallace, Sanchez.
Here. You have a quorum? All right. If I could have a motion and a second to approve the minutes of August 18th, 2021.
So move.
Mr. Tepe moves.
Lewis, second.
Lewis seconds. Any questions, comments, additions, or deletions? Hearing and seeing none, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro, Strathman,
Yes.
Tepe,
Yes.
Wallace, Silva, Sanchez.
Yes.
That passes.
Okay. Do we have anyone, finance and budget, is there any questions about the financial reports for the health department this month? Okay. Public comments on agenda items. I don't see anyone here. I don't see anyone online that I don't recognize. So we'll move on to the executive director section or update on COVID-19. Ms. Kathy Foster, take it away.
Sorry, I'm used to animal control going first. Okay. So we have Ms. Uche Anwuta, who is going to give the COVID-19 update today. Thank you, Uche.
Morning, can you hear me?
No. No.
Green.
Good morning.
Yeah, that's better. Some of those you got to really sit on top of them.
Okay, so my task this morning is to give an update on our COVID-19 response. My name is Uche Onwuta, and I'm the Director of Health Protection at King County Health Department. So currently, King County, we now have about 67% of our total population vaccinated with the first dose and about 51% vaccinated with second dose. This is the CDC data, and it's a little bit different from what you see on the IDPH website. IDPH website has 55% fully vaccinated. The percent 12 plus fully vaccinated 60%, and our 18 years plus population 62% fully vaccinated. Our 65 plus population, 93% at least first dose and 76% fully vaccinated. King County is still in high transmission. We have about 143.5 cases per 100,000 population as our case rate. That's what puts us in high transmission. Our positivity rate is at 3.42%. It's a little down from where it was the last time that I spoke to you. The recommendation, CDC recommendation is still for an area of high transmission that people in public places, indoors, should wear masks to reduce transmission. Delta variant is really the variant, high in the area. So even those who are vaccinated, we still recommend that they wear masks. So this graph is the weekly cases for school-age children. As you can see, we're in the midst of a surge right now. Since schools went back in session, we've had increases in cases. And I highlighted the last, I think it's September 11th is the last one, the last point there. Ages 5 to 11, 126, 12 to 17, 114, and 106 for 18 to 22. As you can see, this is much higher than where we were in June when school was not in session. And currently we have 14 schools in outbreak, 14 outbreaks in schools. This is quite a burden on resources in King County, managing the cases as well as the contacts in the schools. Issuing letters of release for students to return to school. It's a lot of calls and a lot of contact tracing hours that we put into this, as well as investigating the school outbreaks. So again, this is looking at the variants in King County. We are predominantly Delta. Everything you see there that's more than one is a Delta variant. These are like different strains of the Delta variant. The only 3 in yellow there that are not variant, remember the Alpha variant from earlier in January, we only had 1 case in the last 6 weeks. And that B1, I think, is an error. Probably one of the B1 variants, but the B1575 has not even gotten up to variant of interest, how much more concern. So for the most part, we had 99% Delta in King County the last 6 weeks. So I just put in this to give you an idea of where we are with case investigations. This looks at the cases over time, the several surges that we've had, showing towards the end there that we're in the midst of another surge. Let's see if I know how to use this. Oh, yeah. So another surge going on here. Because of this surge, we've had difficulties meeting up with our obligations for contact tracing, which is a response rate of 95% within 24 hours. We reduced the number of our contact tracers when earlier on when the numbers were very low, we reduced the number of our tracers. And now with the sudden surge, we're having difficulties meeting up with our obligations with contact tracing. So this is where we were end of August. Looking at initial outreach, 30%, 35%, 15%, 22%, 16%. And this is due to the sudden surge and not being able to quickly increase our tracers. So we currently have 15 tracers actively doing contact tracing. With the surge. We've been able to tentatively start training additional tracers that will be coming on board. But this is the consequence of that. So I put in this slide again this month because it's still important for us to understand the devastation that Delta variant is in the community. It's twice as contagious as the original strain. It may cause more severe illness than the other strains, and infections are occurring among vaccinated people, even though at a lower rate than unvaccinated people. But we do know that vaccinated people, when they contract Delta variant, can transmit it to others, and that vaccination has been shown to protect against severe illness. We know that unvaccinated people who are infected with Delta and other strains have more severe illness and death than vaccinated people. The reason why we strongly recommend vaccination. I think that's my last slide. Thank you.
And Uche, can you send that report out to everyone on the committee?
Sure.
Thank you. Are there any questions on this presentation?
Oh, Mr. Chairman, Shepro.
Go ahead, Mr. Shepro.
Of the cases of children, are those hospitalizations or just positive tests? And if they're not hospitalizations, do you have any data on how many of the children have been actually hospitalized?
These are cases. I can prepare the slide for vaccinated children for the next meeting. I did not include that here.
I'm just wondering if it's starting to become a burden on the hospitals, as it seems to be downstate.
So right now, our cases, COVID cases hospitalized, we still have capacity in our hospitals thanks to the high vaccination rate in King County compared to the southern counties, where their vaccination rates are very low. And some of their counties actually are over capacity in the hospitals. They don't have any more hospital beds in the ICU. We're not seeing that at this time in King County.
I think the Tribune had a story in the last couple of days in which they said that the downstate, whatever that definition was had zero capacity in the hospitals and in the ICUs.
Yes.
Thank you.
Any other questions or comments?
Mr.
Molina
Chair,
with a question.
Go ahead, Mr. Wallace.
I just wanted to let the record reflect that I'm present.
I'm sorry, could you repeat that? I didn't quite catch it.
I'm sorry, I just wanted to let the record reflect that I'm present.
Oh, okay,
I
yeah,
wasn't
we
here at
got
the
you.
beginning.
We saw
right,
you when
thank
you
you.
logged into Zoom, so.
Thank you.
I have a,
Madam Chair.
hi, good morning.
Good morning, Madam Chair.
I know that Pfizer now has been approved. Is that correct? Officially approved for vaccination for our children? And how are we planning to initiate that launch for the students? I hear a no.
Yeah.
Sure. Pfizer has not
Ms.
been
Barrett,
approved.
can you say your
for-
name? first,
Sorry,
please, for the record.
Laura Barrett, Director of Disease Prevention at King County Health Department. Pfizer has not been finalized or approved. The research is being reviewed by the FDA and then the ACIP, and we will get that guidance then after that from IDPH. So they have presented findings in research and released that, but it's not been approved for the 5 to 11-year-olds at this time, only the 12 and older.
So it's most likely forthcoming.
Possibly. We're waiting, it just as with the boosters for Pfizer last week, the decision was at the FDA level, it's still going to ACIP for adults that are already there for the boosters. They're looking at that for 65-year-olds and older. So we'll wait for the research and let the decision come from there, what they see from that research right now.
Okay, all right. And if it is approved, I'm sure that you're talking internally about the ramp up and how that's going to impact us. Okay, good. Thank you. That's all I wanted to know.
Okay.
Yeah, that I'm sure you're on it. I just want to confirm.
Yes, we are.
Okay, thank
We
you.
already have numbers, and we are definitely forging ahead to assist with vaccinations in the community. So we will be there, and we've been open the whole time. So there's been other places have not. We have, thanks to our support from the county board with our mass vax clinic. So we appreciate that. So there was a question.
Ms. Molina, you have a question?
Hi, yes, thank you, Chairman Sanchez. My question relates to positive cases in the schools. Could you provide me with kind of what the steps are for guidance that the schools are given if there's a child that tests positive? What children in the classroom are reached out to let them know that there's a positive case? And if those kids are vaccinated, do they still need to be quarantining for 14 days, meaning out of school for that period of time?
Okay. Thank you for that question. When we identify a case in the school, we do a proper contact tracing to see whether
Your mic's on your computer. We're getting a little feedback.
Thought I was muted, sorry.
Oh, they
Okay.
got it. Never mind.
yeah.
Sorry, Ms. Muda.
So we do proper contact tracing to find out, who is exposed, whether in the classroom, in the bus, and then we determine whether the person is vaccinated or not vaccinated. And if they're vaccinated, they can return to school. But it doesn't mean that they don't monitor for symptoms. They still have to monitor for symptoms. Vaccinated or not, anybody that has symptoms will have to test and be quarantined. For those who are for those who are not vaccinated sorry, I lost my train of thought. For those who are not vaccinated and they're exposed to the case, they will be quarantined for 14 days. I don't know if you saw the executive order from the governor enforcing those quarantine and isolation right now in the schools. So that's our guidance for the schools. Those who are exposed, we have to do a contact tracing because the fact that you're in the same classroom doesn't always mean that you're exposed to the case if they are properly following the guidance that are set out for schools. Only those who are exposed to that case will be affected.
And is the,
Oh,
sorry,
go ahead, Ms. Molina.
follow up. And is the contact tracing being done by the schools themselves? Are they reaching out to the families, or is that something that the public health department has had to take on?
We're working with the schools on contact tracing. We have our contact tracers, but again, we're relying a lot on the schools in terms of how these children are exposed. And as you can imagine, the guidance came out right when school started, and it keeps changing. So I can't even tell you exactly what it is right now, because we're working on making some changes based on the guidance that we received from IDPH. So when that comes out, it's going to be different from what happened last week. So.
Okay, thank you. I know you guys are doing everything you can, and I think it's really important that as the county board, we continue to support the contact tracing, because as a mother of a high school student, I'm seeing a lot of her friends, and even though they're vaccinated, they're being quarantined because they're being exposed either through the bus or through sports. But again, thank you so much for the work you're doing.
You're welcome.
Mr. Tippy?
Thank you. I've got a few comments and questions, so let me start off with the first one. Friend of mine talked about the fact that he had been contracted COVID, and he was very complimentary about the way that he was contacted each day by the tracers. So I'm sure you probably hear a lot of complaints about that. I thought it might be nice if you heard a compliment about that being done well. Okay. Second, I'd like to thank Ms. Foster and Mr. Isaacson for responding to my email this weekend, but unfortunately, it's still confusing me. Okay. First off, if you are immunocompromised, you can get the booster shot. Okay. And it says so on the website. However, when you go to the website to make an appointment at one of our vaccination center, it says that you're getting the first or the second shot. So if there's some way you could clear that up for the immunocompromised, that would help. So even though it's explained on the website, when you go to make an appointment, that gets a little bit confusing, and any way that we can reduce the confusion would help. And third, with all of the publicity about getting booster shots and when that's going to happen and when that's going to get approved, is there some way we could clear this up? I know I'm going to send out the communication that I received from Ms. Foster, and thank you for that. That does clear it up. But there's so much misconfusion out there due to the press and everybody talking about it. I wish there was some way we could clear that up, because I'm tired of getting phone calls and emails about it. You are probably too. No suggestions, huh? Thanks.
Thank you. We will definitely look into that option for the immunocompromised.
And I think just to clarify, there has been a lot in the media about those booster shots, but a lot of what's been out is really speculative. And so we appreciate the confusion and the frustration. We're in the exact same situation where the public is told that they can get a third dose, and the date of September 20th was put out there that people could start getting doses. But the actual guidance wasn't there yet. So there were meetings that occurred, or a meeting that occurred last week. So we do anticipate that new guidance being finalized. I have experts on either side of me here that I'll look to. But as you said, Mr. Tepe, the media gets out ahead of it and says that the shots are going to be available before they actually are. And I think even to Madam Chair's question with the children, they start talking about it, which is good that there's so much attention, but that gets out in the public before it's actually formally ready. So we'll continue to try to get the best information out that we can.
If one of you would email or call me as soon as it's approved,
Yeah.
Yes.
I'd appreciate it. Thanks.
Sent it out to the whole board.
Just for the record, that was Michael Isaacson speaking. Excuse me. For those listening at home, any other questions or comments?
Shepro,
Shepro, go
question.
ahead.
Okay, I think actually Michael just answered the follow-up I was going to ask, but Vern's question started with that I guess the implicit idea that the third shot was ready to go, but as I understand it, we are still waiting the actual approval for that to happen, even though we anticipate it will. And we are not yet in a position to take appointments or to get them elsewhere at this point. Is that correct?
This is Kathy Bosser. So I think there's confusion between the booster shot and the additional dose shot. And I can let Laura speak to that right now.
Yeah, so we do have an additional dose that's available for immune compromised, and it's for the moderate to severe immune compromised. So on the website, the canevax.org website, and on the Kane County Health website, right as the first landing page on there is the CDC guidance for what that means for moderate and severe immune compromise. And in a quick nutshell, it's just those who have had a solid organ transplant, so heart, lung, kidney, those who have had bone marrow transplants, those who are on immune suppressive medications as they're going through like chemotherapy. So those are top areas with it. If an individual has a question on it, the CDC, IDPH, and Kane County Health Department all recommend that they have that conversation with their physician to have that conversation to see if they need that additional dose. For immune compromised, it's called an additional dose. It's not called a booster because they most likely have not, their body, because it's immune suppressed, it's not producing the response that we would normally see and those who are not taking immune suppressive medications or treatments. So they would recommend to have an additional dose to see if they can boost that immune system to make that response to meet those that have had just the regular 2 doses with it. That is available now, and it's been available since the 3rd week of August, I believe it was. We were ready to go with those, and we started seeing people the very first day that was available, and we'll continue to have that. We do not require any doctor's note. We do not require any personal health information on that. As they sign the consents, there's an attestation on there. We have information for details on that. The nurses at the clinics can counsel and talk to the person if they have a question about that. But there is no requirement for them to show any proof that they need to have that additional dose. And we don't require that. So they can just walk in and get that, or they can register to get that. If they're having problems with the registration system, I've got that down as a takeaway. I'll take a look at that. That's a state system, and we don't always have a lot of flexibility in that process. So if there's a problem with registering, don't worry, just come on in. We will still get you taken care of. You can always walk in.
Quick follow-up, Shepro.
Go ahead, Shepro.
Is there any distinction in getting the additional a shot depending on which vaccine you received initially?
You should stay with the same vaccine that you received. So we do not cross streams on vaccines. If you've had Pfizer, you stay with Pfizer. If Moderna, stay with Moderna. Janssen has not been approved yet at this point.
So people who would show up to get that need to at least be aware of what they actually, which vaccine they received.
Correct. If they have their card with them or a picture of their card, that's wonderful. If not, we can look them up in the system on site and get that verified so we can make sure we are consistent with the same vaccine they received before. So there should be no delay.
Thank you.
All right. Any other questions or comments before we move on? Okay. We do have a couple resolutions. The first one, authorizing hiring of early childhood mental health consultants for early childhood mental health consultation program. If I could get a motion in a second to discuss and potentially pass this resolution. Anyone like to motion for this?
Lewis motion.
Don't all jump at once.
Silva,
Lewis
second.
motions.
Staffman
Strathman
seconds.
seconds. Ms. Barrett, are you speaking on this one? Oh, Michael.
Michael.
Sure. So this is Michael Isaacson. This is a program that we were fortunate to be approached by an organization that's called CHADOC, which manages a statewide initiative to provide supports for early childhood centers and home-based childcare in Illinois. Because of the work that we were doing on behavioral health here in Kane County, they approached us and offered us a grant in 2019. Now there's additional funding available. So currently we have one PhD community psychologist who works with community centers. As you can see on the resolution, this is a grant that covers both Kane and DuPage counties. There's now additional funding that's being made available so that we're going to be able to hire 1.5 additional FTEs to help provide support. Of course, behavioral health is one of the top health issues that's been identified in our community. And over the past 10 years, we've been hearing more and more reports about how mental health issues and behavioral issues are showing up in more and more kids at younger and younger ages, and it's more and more severe. So the support that this program provides is really amazing to be able to get in there. Our clients aren't the kids. Our clients are actually the centers to give them the skills that they can help work with families more effectively. And we always like to point out that this is 100% grant funded. When we hire people, we will let them know that this is grant funded, that it's dependent on grant funding. And with this additional money, so our previous grant was about 91,000. And with this additional 136,000, it's going to cover all the costs associated, all the travel, the phones, et cetera. So this is a self-contained project, and we're really thrilled to have this opportunity.
Mr. Tepe?
Tepe here. Michael, would you expand upon how you're going to work with the organizations and which organizations, or at least reference a couple of them that you would be working with, and how this individual would be utilized in regard to helping those organizations?
Yeah, absolutely. The typical way that somebody may approach us with this program is there may be a behavioral issue that's seen in a center or a home-based childcare setting. And our staff go in and they do trainings or they do observations, and actually will watch and give guidance so that they can help people to better deal with the situations that are occurring. If a 5-year-old, for example, is punching kids in their class, I think as a community, we're getting better, and certainly as providers, we're getting better at understanding that's not just a behavioral issue. There's things going on in that 5-year-old's life that are impacting that behavior. They may not have eaten for 2 days. They may have had a family member who they had to witness violence that morning. So it makes sense that they're showing up in childcare settings and acting out. So our staff are able to work with them, get them better coping mechanisms. And then I think more to your question, we can get that whole system set up so that we can have better linkages. So not only for the child, but also for the family members, we can connect them into other behavioral health settings, or not just behavioral health, it could be food, it could be rent assistance, et cetera, to make sure that that family is getting what they need. It could be help with domestic violence, et cetera. So with our IRIS electronic referral system that we've been rolling out over the past several months, that's an easy way for centers to make referrals to get people into appropriate care. But I think just the one sentence description of this program is our staff goes in and is really a resource for these centers. So that's who our customer is how can we build up capacity in these childcare settings so that they can better serve the needs of the families.
So this would extend beyond those people that are working within the IRIS referral system. So if a daycare center, for example, had a situation, they would contact you?
Absolutely. Yes.
Okay.
And we work very closely with all of our childcare centers. So in Kane County, we have over 200, and DuPage County has almost double that. So we're consistently reaching out to all of them to offer trainings. So it can be either an acute situation where we're brought in to do an observation, or it could be just part of ongoing training that's occurring. And we work, there's actually through in our area, it's the YWCA of Metropolitan Chicago, conducts trainings that are certified for childcare centers. So we're part of that system where people can get credit so that they can participate and potentially get more recognition for their center.
So could we get some statistics about how this has been done in the past?
Oh,
and how this is
absolutely.
gonna happen in the future?
Yes, sir.
Or not how it's gonna happen in the future, but, you know, on an ongoing basis?
Absolutely.
Okay,
Yes.
thank you.
Madam Chair?
Just a follow-up question, Michael. So I'm just going to use this as your hypothetical example. You have a child who's acting aggressively, and it's discovered that that child has not had food for 2 days. Obviously, that's a potential root cause, hunger.
Right.
What are the next steps? Once you identify what that is, you can't mitigate the problem for that child until you're satisfied with the root causes. So how does it go down the chain so that that family as a whole the issue can be addressed within the family? What happens then?
Absolutely. So we have an early childhood network, which is called the AOK, All Our Kids Network, that's been meeting in Kane County for over 20 years. Over the past year, we formed actually for food security, a specific subgroup who's looking at that and has been offering assistance to families. But I think the key linchpin to this is the IRIS electronic referral system, which we're probably going to talk about, I would think, in coming months here at this meeting to share some statistics. This launched earlier this year, and that's a way that a center or a provider can actually make a formal referral to get a family or to get an individual linked with a service. And that service could be behavioral health services, it could be medical services, it could be food assistance. So when we identify things, we now have this electronic system where the referral is made. We can see if the referral is accepted at the receiving agency. And then we can also see if the family followed up on the referral. Whereas previously, maybe we hand the person a piece of paper and say, here's some places you can go, which we're giving them some information. That's good. But we had no idea what happened next. Now with this new system, which we've been able to implement, pay for completely with outside grant funds, now we can track all of that, and it gives us a better way to see not only where are our unmet needs, but where are our needs where people are actually taking advantage of the resources that we have available. We have what we call our second quarterly meeting for IRIS coming up in October. So internally, we've been talking about after that meeting, maybe a really good time to share more information with the board because we'll have all our updated statistics, 6 months worth of information.
That would be very good. And then going back to that child, since that initiated the search, is that then child's behavior watched and monitored over a period of time to make sure that their needs, their social, emotional, and physical needs then are being satisfied?
Yeah, and that's where I think the focus is really on the center with this particular program, where we don't come in and take on just the individual child. It's really how for that support network, can we give them the skills, the resources, the ability to link with other services to build up their capacity? Because that one child, that may have been what initiated the phone call to us. But unfortunately, next year, there's going to be another child in another classroom in that same center who also has issues. So we care about every individual child, but our focus is really on building that capacity so that they can deal with all the children that are coming through with their myriad of issues. So yeah, but absolutely, then the center would be able to continue to provide supports. Hopefully, if people are in home visiting programs, which Laura supervises, they've been a major, I think, benefactor of using the IRIS system and have really done an excellent job with that. We're able to get even more supports around our families so that we can reduce bigger issues in the future.
Very good. Excellent. Thank you.
this is a really exciting program.
I'm
Or
excited to
a
hear.
couple of them,
I
actually.
really am
yeah.
excited to hear more and see how the county can help support this.
Commissioner
Question.
Silva? Question, Commissioner Silva?
Dr. Silva, go ahead.
Thank you. Good morning. Hopefully, I was having trouble earlier. You recorded my votes as yes. My question pertains to human trafficking. It's alive and well in the area. And I'm wondering, are we in touch with law enforcement agencies to provide them with resources and answers to some of the factors that pertain to teenage runaways and also potential human trafficking? Oftentimes I see kids selling things at stores and, you know, it seems like a makeshift badge. And I always wonder, you know, are you okay? Massage parlors, a couple of different things that, you know, could raise some red flags. Are we providing, do we have an active communication with law enforcement officials regarding some of the things that we can, red flags that we can help them to identify?
I can say that we are participating in networks that have more of a focus on that. So we do work pretty closely with law enforcement, especially around behavioral health issues. I think there's more that we could probably do to broaden how much the county is addressing that particular issue. But I know we are working with not only law enforcement, but also emergency departments, which is a key place to identify potential situations like you're describing. So it's something that we do pay attention to, and I would say we're peripherally involved. But that is another opportunity with the IRIS system, I think, where we could help providers make it easier for them to make a referral to an organization if they see something that looks amiss.
And perhaps we might benefit from some training from the organizations that do centralize the identification of this behavior, so that we can continue to provide that peripheral support. But I do feel it's from what I've looked at and what I've seen, it does seem to be ongoing and pretty much everywhere. So we're no exception. So I would wonder if we could benefit from some training ourselves, and then just keep the conversation going. Just keep that, just keeping in mind that identifying a teenager who may or may not have run away is very much at risk from all this predatory behavior. I think these rings who are constantly calling our phones, trying to scam us for information regarding our bank accounts and IRS. I think they're rings who are actually, they're not just involved in financial illegal activity. They're probably involved in other things that could get into our community. So thank you. I'd love to continue the conversation on that.
Very good. I'll follow up with you, Dr. Silva, and we'll get some contact information so we can do that training, not only with our staff, but also with the other providers that we work with, because it certainly is a big issue. Thank you.
Thank you.
Any other questions or comments?
Shepro?
Shepro?
This shouldn't hold up action today, but in looking at the therefore be it resolved, it would seem to me, and maybe this is a question for the state's attorney, it's the two things. One is that, you know, if we replace a janitor, the resolution says we are waiving our hiring freeze. These are, even though they are temporary, these are new positions, and yet we don't refer to that in the resolution. And it occurs to me that an amended resolution on the hiring freeze, I think, is making its way to the full board with some changes to speed up the process. And while they're doing that, it might be a good idea to also add an exception for temporary positions. I don't think it's already in there, but it also seems to me it's the board that creates the position, and it may be the chairman or the executive director that does the hiring. So I guess I'd like the state's attorney to look at that and see if at some point before this gets to full board, if there's a amendment necessary that could be accomplished.
Thank you, Mr. Shepard. We'll ask the state's attorney to look into it. If there's any amendments that need to be made at the next meeting that this resolution goes on to, then we can make that happen.
Right.
Yes, thank you for the suggestion. Madam Chair?
I was just shown a note by Director Fosser. This program is grant funded, so I believe the funding would be restricted to the individuals funded within that grant only. And well thought out, Mr. Shepard. I appreciate your comments, but it could not be hiring of a support staff, custodial staff. It would have to be apple to apple for this grant, because that
I think you misunderstood my analogy. I was simply saying we waive the hiring freeze even for a job like that, not that somebody would divert these funds. It's clear that these funds are restricted and they are, to use Mr. Caius's favorite term, sunsetted when the grant expires.
We'll get an answer from the state's attorney
Yeah.
on this, and if we need to make any changes or
All right, thank you.
anything like that, we will. Okay, clerk, could you please call the roll?
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Tepe,
Tepe, yes.
Wallace, Silva,
Silva, yes.
Sanchez.
Yes. Okay, resolution
passes.
passes. If I could get a motion and a second for a resolution authorizing FY21 budget adjustment for lease and operating costs of vaccination sites and clinics.
So move, Tepe.
Silva moves.
Tepe moves, Silva seconds. This is extending the lease agreement we have at the Batavia site, the Vax Hub. Are there any questions or comments on this resolution? Madam Chair.
I just have one. In the resolution, it mentions how many community members in Kane County has passed away. Isn't that correct? Because of COVID? I think it was, is it in there? I just want to make sure it reflects the current number.
Yes, in the second whereas.
Second whereas.
831 deaths.
So what is it now? 847?
Is that where it's
Is
at?
that the correct number? So if we can update it as of today's number, and then we'll leave it at that as we go through, because hopefully that'll be enough.
Shepro, comment.
Mr. Shepro?
Yeah, if the idea is to have current, maybe instead of changing it now, when this gets to the full board, which would be what, October something, you can plug in that number instead of changing it every time it gets to a different committee.
That makes sense. I'd accept that. I'll withdraw.
I'll look forward to your amendment at the next county board, Mr. Shepro.
Thank you, sir.
All right, any other questions or comments on this resolution? Mr. Coyle, you have a comment? Assistant State's Attorney Vince Coyle.
Vincent Coyle, okay. Just one Scrivener's error on the title on the agenda. It should be license, not lease. It's nothing
Okay.
but that would be the only change.
Okay.
That needs to be noted. So, thank you.
All right, clerk, could you please?
Is that a Scrivener's error, Shepro? Is that a Scrivener's error?
Yeah.
State's
Scrivener's
attorney, so we don't need an amendment.
error. Right.
Great.
Correct that in between the meetings. Okay, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Tepe,
Tepe, yes.
Wallace, Silva,
Silva, yes.
Sanchez.
Yes.
Passes.
Okay, next we have animal control. Brett is on the line to give us.
Good morning, everyone. How are you?
Good.
real quick this month, revenue exceeded expenses, which is what we always want, but I always like to keep you updated. The big thing coming up is October 2nd is our final vaccine clinic of the year. We're very excited. So far, our numbers this year have been 343 dogs vaccinated, 67 cats, and 83 microchips. This has been a fantastic year. Our clinics grow every year, and with still one Saturday clinic to go, we're very excited. So again, October 2nd, we're continuing to get the word out every way we can, and we're very excited about that. The only other thing I have is to keep you guys informed. Our warden position has been posted for 1 year now. We've received all of about 6 to 7 applicants, and part of that is due to salary. We're just being crushed. Same thing with our part-time kennel assistants. We're flipping through really fast. Again, being paid $12 an hour when Chipotle and all those places are paying $15 is very difficult for us. I know they're doing the business analysis, but that's expected to take at least a year to be completed. We're just hurting to get positions filled, and it's difficult to keep up with this market. That's all I have this month. If anybody has questions for me, please let me know.
Any questions, Madam Chair?
Just an update. Now that I have my dog, I'm more aware of the pet life. How many dogs and cats do you have currently that need home placements? Have you seen an uptick in that, or has the adoption rate gone up? Just curious about what the numbers of animals that we're helping out.
At our facility, we're very good right now. We have about 8 cats in the facility and 4 dogs. We're doing good at the moment, but in the area, numbers are going back up. As people are returning to work, the shelters are filling back up with all those pets that got adopted. Adoption rates have dropped. Rescues are full. It's a nationwide issue right now. It was so great at the beginning of the pandemic. It's just unfortunate that as people are returning to work, animals are coming back into the shelter system. Thankfully, we're at a very good position right now. We maintain our population very closely. We have multiple discussions throughout the week on what we're doing with our population and still ensuring that animals go out the front door to the best of our ability that we can.
Okay, thank you.
Mr. Tepe?
Tepe here. I stopped in at the animal control shelter a couple weeks ago, and Brett gave me a really great tour. It's a facility that we should all visit. And, you know, one of the ideas that I would like that Brett and I discussed that we'd like to pursue is maybe doing some of these clinics in conjunction with townships or other organizations so that we can spread out the clinics and get some more advertising associated with what's happening. So hopefully we can work on ideas like that. But anyway, thanks, Brett.
Of course, and thank you for coming. It is always appreciated.
Silva, question.
Dr. Silva, go ahead.
Do we have any interest in a fostering program? Is there any data on the benefits of a fostering program?
Fostering programs are fantastic ideas. They're just difficult to do at the county level. Our resources are spent picking up the straying animals and reuniting them with their owners. To run a foster program, I would need to hire on another person. And that would, again, add another staff member when, in all honesty, I have other places I need that staff member or that funds to go back into those positions to pay the people I currently have more money so I don't have such a high turnover. Fostering is a great program, but it really has to be monitored closely where you check in with the people weekly. You have to keep up with them. What we'd rather do is promote those rescue agencies around us that have foster programs because those agencies can then pull the animal from us to go into a foster home.
Thank you for the information.
Question, Shepro.
Mr. Shepro?
Brad, what is the operational consequence, if that's the right word, of going a full year without that warden position being filled? Is that overtime? Is it things can't be done that should be done? Could you give us maybe a quick sketch of how that's affecting what you're doing?
Of course. Our wardens are on 24/7. So there is always someone on call to pick up our emergency line. What that has basically meant is the job of 3 wardens has been pushed onto 2. So those wardens every other week, so for 52 weeks, 26 of them, they are on call. That limits their ability to go on vacation because, again, they have been phenomenal. No complaints. They've done their job. And again, these calls are coming in anywhere from 8 p.m. all the way till 7 a.m. in the morning. So they're up at night answering calls from municipalities, from citizens, helping to guide people to the right thing. So going out on calls, they've been phenomenal, have not complained. It is an overtime, and we budget that every year into our overtime. So we know about $18,000 a year is going to go into that overtime to be able to do that for this community. This is why some animal controls have actually eliminated after hours calls. We've been doing our best to not do that because we feel it is such a way that we can assist in this community that we don't want to take that away.
And what would be, in your view, a competitive hourly rate compared to the 12 that you currently have?
So let me put it this way. We're the 5th largest county. The 15th largest county in Illinois is currently offering $19 an hour to their warden to start, and that's with no training. We're offering $14. So that's a $5 difference. People are coming here to get trained, and then they're going to a county that has less work, and they're being paid more, and it's unfortunate because we do a lot here for our community. These wardens that do work for me are phenomenal. I can't speak enough about how wonderful my whole staff is here. They really understand the importance. They push through, but unfortunately the turnover is just unfortunate because then you got to retrain someone. I got to pay for all those new training courses. I got to put them through all the motions, and it takes about a year to get a warden up to speed on what they need to do. And it's just, it's hard and it's difficult. But again, we continue to do what we need to do, but we need to be more competitive with our local municipalities if we want to continue to have animal control, especially here in Kane County, be a position of strength.
You stated that very well. Thank you.
Thank you.
Mr. Chairman,
Ms. Strathman?
I have a question for Brett Strathman here. Is there a program for reduced rate spay and neutering?
Yes, there's a couple that, we don't have one here in Kane County, but there are a couple groups that do offer low-cost spay neutering. Fox Valley Animal Welfare is one of them, right off the top of my head, excuse me, I can't remember the other. Spay Illinois, that do offer very reduced rate spay neutering. So we do try to get people pushed to those places as best as we can. But with the hard times we're all currently in, they've just been backed up. Again, doing mass spay neutering all day takes a complex situation. Anti-Cruelty Society just built a couple $1 million facility to do this. Paw Chicago has one as well. It's a really big facility. It's not something we'd be able to add on to this facility. But we try to get our citizens pushed in the right direction into the places that offer those services.
Could you repeat the names of those two places again for me,
Oh,
please?
of course. It's Fox Valley Animal Welfare and Spay Illinois.
Thank you.
Of course.
May I?
Madam Chair.
Brett, as a follow-up to Mrs. Strathman's comments, do you have any idea what the cost is for spaying, the average cost here in Kane County to get your dog or cat spayed?
At an average veterinarian or low cost?
No, the market rate, not low cost.
It's about
the market rate.
$300.
$300.
Yeah.
And I'm about to pay more than that.
Yeah, that's what I'm saying. Average is about 300.
Yes, and for people who want to adopt a dog, to have that included. And the spay clinics, what is the cost for that?
I don't have it at the top of my head. I'm sorry. I'm trying to see if I can pull it up for you real quick here. But it's only around $100 to $200. But again, please don't quote me. I don't have it right in front of me.
Okay. All right. Still a significant cost for a low-income household who takes
Correct.
on a pet.
Correct.
Okay. All right. Thank you.
All right, thanks, Brett, for your report, for being here this morning.
Of course. Thank you, everyone. I really appreciate it.
Okay, we have nothing for old business. No reports to place on file. No need for executive session. New business, I just wanted to share a little bit of humor. I like to collect belt buckles. And so recently, you can't see what I'm wearing right now. So I have a picture of it. I just wanted to share with everybody. You might find it somewhat humorous. Figure it's topical. Thought it was interesting. Pfizer, once upon a time, was involved in genetics for corn and soy and things like that. So they probably still do. To me, that's just hilarious, especially all the conspiracies about vaccines. So just wanted to share that all with you today. We have no one here for public comments. I just need a motion and a second to adjourn.
May I take
Mr.
Mr.
Tepe?
Kenyon's responsibility, General,
Yeah.
and
The
generally,
honorary
and move
Kenyon
for-
motion.
move for adjournment.
Strathman second.
Strathman seconds. All those in favor say aye.
Aye.
Thank you. We are adjourned.